There's a lot to break down with two versions of the vaccine now and growing concern about this new COVID strain that appears to be more contagious. To help answer some of our questions, we now turn to NBC News medical contributor Dr. Natalie Azar. Good morning to you. So as you know, there have been reports from Britain and South Africa of new coronavirus strains that appear to spread more easily. It's scary when you hear about it. For people watching this morning, is there reason for alarm, and should we be concerned that the current vaccines won't protect against these new strains?
Yeah, right. So, Chanel, experts basically look at three things whenever there are variants to a virus. They look at how easily it spreads, the disease that it causes, and whether or not it can evade protection. Regarding transmissibility, yes, there is a thought that it is about 50 to 70% more transmissible. At the moment, it does not appear to be more pathogenic, meaning that it doesn't appear to cause more severe illness, although experts have urged caution because there is a lag following infection when hospitalizations and deaths can occur. Regarding whether or not it can evade protection, at the moment, experts are saying that it's unlikely that the vaccine will not be effective against this new strain. I will say, though, that the UK is currently doing studies on exactly this. They are taking antibodies from people who've recovered from COVID and who've received the vaccine, and they're doing lab experiments to see whether or not it, in fact, does neutralize the variant.
Yikes, have to keep us posted on that. Dr. Natalie, we are currently in phase 1A of vaccine distribution. That allows healthcare workers, long-term care facility residents to get the vaccine. But a CDC panel voted Sunday on a recommendation for future phases as well. So who is going to get the vaccine next?
Right, Dylan. So in phase 1B, we're going to have individuals who are age 75 and older, as well as what are called frontline essential workers. This includes folks, first responders, teachers, folks who work in food and agriculture, postal service, transit. Then we have phase 1C. That includes individuals age 65 to 74, as well as people age 60 to 64 with underlying medical conditions such as kidney disease, cancer, diabetes, obesity. And in this group also are the remainder of the essential workers, people who work in IT, energy, public safety, water. The phase 1B includes about 49 million people and phase 1C about 129 million people, Dylan.
Hey, Dr. Natalie, and you tell me if you don't want to answer, but I'm still going to ask you. Have you gotten the vaccine yet?
So we just got our notification this morning, or maybe late last night when I was asleep. So I am scheduling it. It's either going to be this evening or tomorrow.
Wow.
Oh, excellent. And this would be the Pfizer vaccine, I assume?
It is my understanding that we are still doing the Pfizer vaccine here, yes.
Okay. Hey, just really quickly before we let you get out of here, there have been, as you know, a number of reports about allergic reactions to the vaccines. If people experience an allergic reaction, what should they do?
Well, the first thing, Craig, is to avoid that scenario, right? So number one, you're going to talk to your healthcare provider. There was a slight modification from last week. You may recall that the CD said certainly that if you have had an allergic reaction to anything in the current vaccine, you should not receive the vaccine. And last week, they also said if you've ever had an allergy to an injectable product or a vaccine, you shouldn't get it. Now they are saying that you can have a conversation with your healthcare provider, that is still on the table for you. In addition, if you've had allergic reactions to food or medications. But to prevent that from happening, what do you do if you've had an allergic reaction? You want to have that vaccine in a place that has the capacity to deal with an anaphylactic reaction, Craig.
Dr. Natalie Azar, always useful information, and we are so glad you're getting that vaccine today, Dr. Natalie. Thank you.
Thanks, Craig.